Hello and welcome to the CityStudio Substance Use Health and Stigma Awareness Initiative. Today we will be talking about the substance use spectrum. Here we have three individuals. This is Jason. He is a 21-year-old fourth-year university student studying engineering. It is exam season, so he has been drinking coffee every morning to help him get started studying for the day. He says he focuses much better and has more energy when he has his morning coffee. This is Mary. She is a 39-year-old mother of four. She has a small business selling handmade jewelry and takes care of her kids at home full-time. She has 1 to 2 drinks a week while having dinner with her partner to de-stress from work and taking care of the kids. She also occasionally uses cannabis to help her relax and to deal with headaches. This is Frank. He is a 52-year-old banker. A year and a half ago, he broke his hip in a skiing accident and had to undergo hip surgery. He was prescribed pain medication to deal with the pain, but soon noticed that even after he fully recovered from his surgery, if he doesn't take his painkillers, he will experience withdrawal symptoms like irritability, sweats, nausea, and flu-like symptoms. Due to this, Frank has lost his job and is having a hard time finding a new one. Out of these three people, who do you think uses substances? Before we try to identify them, we should first understand what substances are. A substance is any material that could cause physical and/or psychological effects on the body when consumed. You can swallow substances, breathe it in as a gas, vapor, or smoke, or inject it directly into your body. Substances are also different from food in that they do not provide any nutritional support. Some examples of substances include caffeine, nicotine, alcohol, opioids, stimulants, and more. So with this information in mind, which of these three individuals use substances? That's right, they all do. It is important to know that substance use is a spectrum with different degrees of benefits and harms, which are subjective to the individual who uses substances. On this line, we have 5 different stages of substance usage. On the very left, we have no use, which include people who do not use substances of any kind. Next, we have beneficial use. This means that using the substance has positive health and social impacts on the person who is using it. In the middle, we have lower risk use. Those who fall into this category use substances occasionally with no significant social or health effects. Moving down the spectrum, we have problem occurring use, where the substance has negative consequences for the individual using it and people around them. Finally, on the far right, we have substance use disorder. This is a diagnosable medical condition when consequences don't change a pattern of use. Keep in mind that substance use can change from day to day, and we can move through multiple stages of the spectrum during different circumstances. This spectrum is also inclusive to everyone, meaning that everyone falls somewhere on the spectrum. With that said, currently, where would you put Jason, Mary, and Frank on the spectrum? Feel free to pause and discuss. Jason would fall into the beneficial use category. He is using caffeine to help him function better and study better during this stressful exam season. Mary will fall into the lower risk category. She uses cannabis only occasionally and has 1 to 2 drinks a week, which are within the Canadian Guidance on Alcohol and Health's guidelines for low risk alcohol use. Frank would fall into the substance use disorder category. He has a clear pattern of opioid use over a 12-month period. It is also implied that he has clinically significant everyday life impairments and stress. Now, with this information in mind, consider your own substance use health. What does your relationship to substances look like? Where do you fall on the spectrum? Please note that all scenarios you've seen in this video are fictional examples describing the spectrum. Please speak with your healthcare provider about your substance use health. For more information on substance use health, visit www.capsa.ca and www.ottawapublichealth.ca.